Dispatch to ambulance 725, come in.
Ambulance 725 responding.
Code 4 to Durham College, Ashleigh campus, unconscious male, mid-20s.
Copy dispatch, en route.
Dispatch out.
So the environment is safe for myself, my partner, and my patient. Mechanism of injury is unknown at this moment. Casualty, we have one with one bystander, it appears. Allied agencies, we're going to call for fire to help us with transport. And PPE, we have our gloves on. Got it. All right, Ashleigh, it appears as if we can get our stretcher all the way in, so let's get on in there. Let's go. Ashleigh, my general impression is that the patient is sitting upright. He appears to be unconscious. He is not tracking me with his eyes. Hi, my name's Carina. This is my partner, Ashleigh. We're paramedics. How can we help you today?
Yeah, my friend Tom, we were playing hockey earlier. He got checked in the boards and he went unconscious briefly. And then he went home to go rest, and now he came back and we're having class and he fell asleep and now he won't wake up.
Okay, Ashleigh, can I get you to hold C-spine for me? Yep. You said his name is Tom?
Yeah.
How old is Tom?
He's 20.
20? Tom, can you hear me? No response to verbal. Tom, can you hear me? No response to pain. Checking carotid and radial pulse. I have a weak but regular carotid and radial pulse. I'm looking in the airway. Don't see anything in the airway. Airway appears to be patent. Checking breathing. Patient is breathing at a slow but appears to be deep breath. I'm just gonna auscultate and listen to the lungs real quick. And I've got clear air entry, apex to base bilaterally. I'm just gonna check Tom. All right, Ashleigh, I'm gonna need to do a wet check, but first I think we need to move Tom away from the desk. Is that okay? Okay, so we're gonna do it on your count. We'll move back and then to the side, just so I can get a good visualization of everything. Okay.
I'm a volunteer firefighter if you need help with anything.
Actually, yeah, if you can just assist in the move, and then I'm actually gonna get you to switch spots with my partner. Are you comfortable holding C-spine?
Yes.
Yeah? Perfect. All right, so Ashleigh, on your count.
Okay, so 1, 2, 3. Back. 1, 2. And we're gonna move to the side.
Okay, on your count.
1, 2, 3.
Everyone's still good?
Yep.
All right, I'll get him right into the center. Perfect. All right, I'm gonna get you to actually switch with my partner. You can just grab C-spine there. Perfect. Awesome. Perfect. Okay, Ashleigh, I'm gonna get you to start some vitals for me. If you can start with respiratory rate and report back to me, okay? So I'm just gonna continue with a wet check here. Just checking for any blood, vomit, incontinence. Don't see any bodily fluids, and we'll just do a quick RTS head to toe, looking for contusions, lacerations, abrasions.
Respiratory rate's 10.
Perfect. I'll get you to set up the oxygen for me with a non-rebreather, please. Stomach's impact, trachea's midline. There is evidence of mastoid bruising behind the left ear. Equal chest rise and fall. Okay, hips are intact, femurs are intact. And I'm just doing a quick head to toe. I don't see any track marks. No edema of the legs. Checking for any medical scarring. Don't see any medical scarring here. How's the oxygen coming on?
Good, I've got it set to 15.
All right, fire here.
Perfect. Hi, what's your name?
Cody.
Cody, hi Cody. Are you able to get our stretcher set up for us, please? And we're gonna need the scoop stretcher for our transport.
All right.
Okay, perfect. So at this point, this is a load and go scenario. We need to get Tom to the hospital as fast, yet as safe as possible, okay? So if you can continue with those calls. So you said you're his friend?
Yeah.
Can you tell me a little bit more about what was happening this morning?
Yeah, we were playing hockey. We got a really big hit into the boards, and then he went unconscious briefly.
And how long did you say he was unconscious for?
Only a couple seconds.
Alright, so, what did you say your name was?
My name is Matt.
Matt, I'm just gonna put this right in behind Tom's head. And after you guys were done playing hockey, what did you do? Did you go home?
Yeah, we went back with roommates. We went back home, and he went to sleep for a bit, like a couple hours, and then we went to class.
Blood pressure's 136. Alright, so I've got the cervical collar on. Sure, yeah, you know what, leave the blood pressure cuff on, and we can use it as long as it's inflated. At this point, we're gonna move Tom to the ground so that we can get him spinal immobilized on our scoop stretcher. I think that the best way to do this would be to keep Matt on C-spine. Actually, we're gonna do a modified fore and aft. And Cody.
Stretcher set up.
Perfect. Cody, we're gonna get you to move the chair out from underneath
Okay.
Tom as soon as we lift him, okay? So I'm gonna get underneath his shoulder here. His leg. Alright, and Matt, it's gonna be on your count, okay?
Okay, ready?
Ready.
3, 1, 2, 3.
Yeah. Correct. And you're just gonna step away from the wall. You good, Matt?
Yeah.
Okay, down on your count.
Okay. 3, 1, 2, 3.
Great. Okay, so can you tell me if Tom has any medical concerns at all?
No, none that I know of.
Nothing? No allergies?
No.
Has he had any recent surgeries? Anything that you know of?
No, he hasn't.
Okay. Cody, do you mind grabbing my suction for me and just bringing it up beside Tom's head? So Matt, was Tom wearing a helmet when he was checked into the boards?
Yeah.
And he was wearing it properly? It didn't come flying off?
Just normal.
Okay. Did he complain of any symptoms before class at all?
Actually, yeah, you said he had a really bad headache before class.
Okay. Did he take any medications for that you know of?
No.
Does he take any medications regularly?
No, he doesn't.
Supplements?
Some.
Some supplements, vitamins? Okay. Perfect. We got our suction there if necessary.
Also say 6 beats per minute.
Okay, perfect. What we're gonna do now is we're gonna get Tom onto our scoop stretcher. So if Ashleigh, you would like to help me with that. Cody, I'm gonna get you to help me with the lift.
Okay.
And we'll go from there. So gotta set this up. Stretch it out. And Cody, the stretcher's all ready for us?
I'll do the paper flip.
Yes, please check your pupils. Pass that to you, Cody.
Pupils are 3 millimeters unequal and reactive.
Okay, so we're gonna be connecting at the head first. Go, and if you can get down at the feet there. And Cody, if you can grab the straps out of my trauma bag there, I'll need 4 straps, okay? And then I'll get you to strap the chest first, followed by the legs.
right.
Just if we have any more questions about the event,
All right.
hopefully you'll be able to answer them for us. Also, is there anybody that we need to contact for Tom?
Yeah, you should call his parents.
Okay. Do you have their number?
Yeah.
Perfect. You're safe to take your hands off of the blocks now. Tom's head is secure. Everybody is secure here. Perfect. So Ashleigh, I'm gonna get you up on the head here.
Okay.
And Cody, you're gonna lift down by the feet there.
All right.
Matt, if you can grab any of Tom's personal belongings that he's left here and bring them with us in the ambulance, okay?
All right.
I've got some of our bags. And we're gonna get Tom out of here to this hospital safely. So on Ashleigh's count, Cody?
Yep.
All right. 1, 2, 3. Step, 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 and down. Okay, let's get strapped in. Get that blanket on Tom and we'll get him to the hospital safely. All right, Ashleigh, I have got the trauma bag in the suction. If you can grab the oxygen bag. Cody, I'll just get you to guide us out.
Okay.
And Matt, you can follow along as well, okay?
Okay.
I'm just going to get you to have the suction ready beside somebody in case we need it. Perfect. We're just going to get a second set of vitals now on our way to the hospital. Okay, so GCS is still 3. Pupils are unequal yet reactive. Blood pressure is now 128/76. Our skin is pink, cool, and diaphoretic. Respiratory rate is now 14 breaths per minute, and pulse is 84 beats per minute. Perfect.
The end.